Hello guys, welcome and welcome to Minty Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and OET training. And in today's session, we are going to discuss about IGNOU nursing question paper. Yes guys, we received IGNOU question paper and we solved the question paper along with the rational and the answers. So you can counter check with your answer, whatever you have written in the exams. Okay, let's begin the session without wasting the time. The first question is, adenosine triphosphate is an important molecule because it is, and here they have given four options. It is the result of catabolism, stores energy for use by the body cells, is the result of metabolism, releases energy for uncontrolled burst. And here the right answer is option B. So why we selected option B as a right one? Let's see the rationale. See, in order to know the rationale, first you should know how the ATP is produced from our body. Okay, so this is the cell and this is the nucleus, and this one is the mitochondria, and this one is the blood vessel. Inside the blood vessel, three important character is there which is playing a vital role in the production of ATP. What are all those characters? The first one is glucose, second one is insulin, third one is oxygen. So in order to carry the glucose inside the cell, who is required? Insulin is required. So insulin will take the glucose inside the cell. So once glucose enter inside the cell, it will convert into pyruvate. Fine. So, and then after conversion of the glucose into pyruvate, the oxygen is going to enter inside the cell. So pyruvate plus oxygen together, it can reach the mitochondria. And in the mitochondria, as you all know, it is the powerhouse of the cell. It will produce three things. The first one is ATP. Second one is carbon dioxide. Third one is water. ATP, the cells are producing the ATP, and which is very useful for what? Production of energy. Fine. And the second one is carbon dioxide. Carbon dioxide, which is used, or carbon dioxide is the one which is stimulating the medulla oblongata. Medulla oblongata is the respiratory center, right? And also carbon dioxide, it will convert or join with the water to form carbonic acid, which is most essential for our body, okay, in order to maintain the acid-base balance. And the next one is water. Water, which is used for what? Maintaining the fluid volume of our body. Okay, so ATP, which is produced from the cells, and it is required for what? Producing energy. We are talking, I'm making video, you are listening to the classes, everything is happening. It is because of what? Production of ATP. Okay, so that's why we selected option B as a right one. Stores energy for use by the body cells. Clear guys? Let's see the second question. The second one is, all of the following have diuretic effect except, this is the except question. Except question means negative answers. Okay, fine. So four options they have given here: tea, coffee, milk and alcohol. Among these four, which one is having the diuretic effect? Diuretic means what? It increases the excretion of urine. That is called as what? Diuretic, right? Usually we used to use diuretics like, osmotic diuretic, example mannitol, loop diuretic, example furosemide. Yes, potassium sparing diuretics, spironolactone. So these are all the diuretics which is available commercially as a drug, right? And which is the natural diuretic what we are consuming in our day-to-day life. That is what the question is. Okay, so the question is, all of the following have diuretic effect except, and they have given four options, that is tea, coffee, milk and alcohol. And the right answer here is option C, that is milk. See, milk doesn't have the diuretic effect, whereas tea, coffee and alcohol, obviously if the person is taking alcohol, means excess amount of urine output will be there. Okay, so alcohol is having the diuretic effect. And caffeine, tea and coffee, these are all considering under what? Caffeine. Okay, so the caffeine is also having the diuretic effect. So at last, which is left? Milk is left. So milk is the one which doesn't have what? Diuretic effect. The next one, production of less than 50 ml per day of the urine is called as. Very simple question. See, all the question whatever they have asked in these exams are direct and simple questions which we can expect, means 10 years before. Okay, so that kind of question they have asked here in this exams. Okay, fine. So production of less than 50 ml per day of the urine is known as, it is a normal one, polyuria, oliguria, anuria. For these things, what you're supposed to know, you should know the normal values of each and everything. What is the normal urine output? Up to 1500 ml. Okay, fine. And if in case of polyuria, what is the urine output? More than 2000 ml. We can consider as what? Polyuria. It is mentioned here. Fine. And the next one is oliguria. What is oliguria? Oliguria means 100 to 400 ml. How much ml? 100 to 400 ml is called as what? Oliguria. And anuria means absence of urine. So total absence of urine, we cannot say like that. Anuria means less than 100 ml of urine, or 1 or 0 to 100 ml of urine is called as what? Anuria. So normal means up to 1500, polyuria means more than 2000 ml, oliguria means 100 to 400 ml, anuria means 0 to 100 ml or less than 100 ml. And here the question is 50 ml, right? So 50 ml, it is coming in what? Which category? This category. So here which is the right answer? Anuria is the right answer. Okay. For better clarification, here also I have given urine classification on the basis of volume. Okay. Anuria means less than 100 ml per day. Oliguria means less than 400 ml per day. Polyuria means more than 2 liters per day. Okay. Fine. And the next question is the blood cells that destroy invading bacteria or virus. Very simple question. Four options they are given here. Melanocytes. What is melanocytes? Which is producing the color of our body. Okay, that is called as what? Melanocytes. So it is nowhere going to relate with the bacteria or virus. And second one is lymphocytes. Obviously, lymphocytes are the WBCs. There are two types of lymphocytes, that is B lymphocytes and T lymphocytes. T lymphocytes are the killer cells. It is in whatever the bacteria which is invading, it is going to killed by the T lymphocytes. And B lymphocytes are like a messenger cells. It will inform to the T lymphocytes, that is certain kind of bacteria is invaded within the body, so you supposed to kill them. Okay, so these are all the two types of important lymphocytes which is used to assess the invading microorganism and killing the invading microorganism by means of using macrophage or phagocytosis. Okay, the next one is option C, erythrocytes. These are all RBCs. Thrombocytes, these are all platelets. Okay, so here which is the right answer? Option B, that is lymphocytes, is the right answer. In specific, T lymphocytes is the right answer. The next one is electrolyte are mostly lost through. In which mechanism the electrolytes are lost from our body? And they have given four things: renal functioning, sweating, fecal matter and respiration. See, for this question, you should know the normal physiology. See, renal function means excreting the normal urine output per day 1500 ml. It is the normal routine. From the birth till the death, this is going to happen, right? The same way excretion of fecal matter and respiration also every day, every minute, every second it is going to get happen. But what about sweating? If you are doing some strenuous activities, for example, you are running, you are doing jogging, you are working very hard in your working sector, only that time suddenly increasing in the sweating will take place. So whenever there is an increasing in the sweating, it is not the sweating is not happening every day as a natural process. Okay, for example, urine means every day morning the person will wake up and they can void the urine, but every day morning the sweating will not come. If he is doing the strenuous activity, only he can expect or she can expect the sweating in the body. In that case, sweating will happen when you are doing some exaggerated activities. So that time loss of electrolytes will take place. So here the right answer is option B, that is sweating. Sixth question is, most of the body calcium is found in. Very simple question. Okay, So most of the body calcium is found in, direct question, bones. Okay, so in hyperthyroidism case, what will happen? Sorry, hyperparathyroidism, right? So this is the thyroid gland. Okay, the butterfly shaped gland of our body is the thyroid gland, and these are all the parathyroid glands. Parathyroid glands are located within the thyroid gland. Okay guys, and this parathyroid gland is the one which is maintaining the calcium level in our body. Okay, and the calcium is stored in the bones, mainly in the bones. Whenever there is a requirement of calcium in our body, whatever the calcium which is stored in the bones, it will be resorbed back into the blood vessels. This is the blood vessel and this is the bone. Whenever there is a requirement of calcium, the parathyroid gland will activate and it will release the parathyroid hormone, and this parathyroid hormone will tell to the bone to release the calcium in the blood in order to maintain the calcium, because calcium is very much important for the muscle function, especially in the heart. It is used for the contraction of the heart. Okay, and one more thing, if the calcium wants to store within the body or absorbed from the kidney, calciums are absorbed from the kidney, calcium is also absorbed from the small intestine. How it is getting absorbed? It is absorbed by the presence of, okay, once it is getting absorbed, how it is getting activated? See, in the presence of vitamin D only the calcium will get activated. Without vitamin D, the calcium will not get activated. Fine, this is the additional key point. Fine, so calcium is there within the body, but there is no vitamin D, means there is no use at all. Vitamin D should be there for the proper functioning of the calcium, and vitamin D is getting activated in the kidney. This is the another golden point. Fine. So here the right answer is option B, that is bones. The next question is vestigial bony part of the human skeleton. First, you should know the meaning of vestigial bony part. Vestigial bony part means useless part which is there in our body, which is not at all performing any kind of activity. For example, you can take appendix, which is there in the small intestine. The appendix is not doing any kind of function, and it is more prone for what? Appendicitis. Rupture of the appendix will cause peritonitis, right? Fine. And the same way, here they are asking vestigial bony part. So which bony part is not at all having any function in our body? That is coccyx. Fine. So coccyx is the one which doesn't have any function in our body. So here the right answer is option C, that is coccyx. The next one. All of the cranial nerves control function in the head and neck, except, listen to the question carefully, all of the cranial nerve control function in head and neck. Only they are focusing on the head and neck. And they have given 4 options like olfactory, glossopharyngeal, trochlear and vagus. So first you should know cranial nerves. There are 12 pairs of cranial nerves which is there in the body. What are all they? Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, spinal accessory and hypoglossal. These are all the 12 pairs of cranial nerves. Right? Among these 12 pairs, some are responsible for motor function, some are responsible for sensory function, and some are responsible for both motor as well as the sensory functions. And in this question, they specifically asked the cranial nerves which is supplying only in the head and neck. And here the right answer is, okay, this is the except question, right? So here they are asking which among these 4 options, which nerve is not at all supplying in the head and neck. This is the exact way to understand the question. Okay, which nerve among the 4 is not supplying to the head and neck? Olfactory is the one which is responsible for smell, and it is present in the nose, right? So this is, we can remove this option. Glossopharyngeal is the one which is responsible for swallowing reflex, and posterior 1/3 of the taste. Posterior 1/3 of the taste is also responsible for glossopharyngeal. right? So we can remove this one also, because this is also, the tongue is present in the mouth. And trochlear, which is responsible for the movement of the eye, oculomotor, trochlear, abducens, right? Third, fourth and sixth nerve, sixth cranial nerve, these three things are responsible for the movement of the eyes. Okay, fine. So the eye is also present in the head, we can remove that. Vagus nerve, see, actually speaking, vagus and glossopharyngeal together is responsible for the swallowing reflex and also the gag reflex. Okay, so vagus is also playing certain role in the face, but the main role of the vagus is in digestion and controlling the heart rate. Okay, main role is digestion and controlling the heart rate. Okay, and it is also doing some sensory functions like sensations in the skin, muscles and the organs. Okay, but the main function is digestion and heart rate. So this is not performing any major activities in the head and neck. So here we selected this as a right answer. Option D, vagus nerve, we selected as a right answer. And one more important golden point is, vagus nerve is the longest cranial nerve. Vagus nerve is the longest cranial nerve and the largest cranial nerve. Longest is different. Long is vagus nerve. Large is trigeminal nerve. Trigeminal nerve, which is supplying the forehead, maxillary region, mandible region, all over the head, both the sides, right side and left side. Okay, fine. And the ninth question is causative organ of the chicken pox. And here they have given four options: variola minor, variola major, variola zoster, variola simplex. Actually, chicken pox is caused by what? Varicella zoster virus, but that option they have not given here. Variola is the one which is given in all the four options. Varizola or varicella is not there. You can see here, varicella is not there. Everywhere variola. The options are wrong. If you attended this question, definitely they would have given the mark for you. Whether your answer is right or wrong doesn't matter. If you just attend this question, they would have given you the mark, because the option what they are given is wrong. Okay, actually a variola virus is there. No, variola virus is the one which is responsible for smallpox, and varicella is the one which is responsible for chickenpox. And among the varicella, which specifically responsible for chickenpox? Varicella zoster. Varicella zoster virus, which is responsible for the chickenpox. Understand? That option is not there. Instead of varicella, they have mentioned variola zoster. So we can consider variola here as a varicella, and we selected this as a right answer, that is option C. Okay, fine. And other few more golden points are related to chickenpox. The first one is, as I mentioned already, chickenpox is caused by the varicella zoster and smallpox is caused by the variola virus. Fine. And the next important point is, in chickenpox you can see pleomorphic rash. What is pleomorphic rash? Pustules, vesicles, okay, all kind of these small rashes will be present simultaneously in the same place. Okay, so that is called as what? Pleomorphic rashes. You can see here papules, vesicles, pustules. Usually if pustules are there means vesicles will not be there. Vesicles are there means papules will not be there. But here in chickenpox, pustules, vesicle, papules, everything is concurrently, means at the same time present in the patient, means that is called as what? Pleomorphic rash. This is very important. Many times they ask in the competitive exams. Okay, and this pleomorphic rash first you can see in the chest, back and face of the chickenpox affected patient. First you can see in the trunk, followed by that it can spread to the other parts like mouth, eyelids, genital area. Okay, so this is also an important question. The pleomorphic rash for the chickenpox patient first appear in which part of the body? This is how the question is going to be. And here the right answer is what? Trunk, especially in the chest. After that back, and then it will go to the face. Okay guys. The next question is the cell in the pancreas that produces insulin. Very simple question. Okay. So which cell produces insulin in the pancreas? Beta cells. So beta cells are the one called as islets of Langerhans. Right. So here the right answer is option B. Okay. So islets of Langerhans is the right answer. So the other important golden points. See, pancreas is having 4 types of cells. How many types? 4 types. The first one is alpha cells. The alpha cells are the one which is responsible for the production of glucagon. Okay, so glucagon and insulin are just opposite to each other. Glucagon, it increases the glucose level, and insulin, it decreases the glucose level. So alpha cells, glucagon. Beta cells, insulin. And alpha, beta, gamma cells are producing polypeptide. Okay, it is a digestive hormone. Polypeptide is different. It is not an endocrine hormone. Okay, fine. Polypeptide is a digestive hormone which is used for the digestion of protein. Okay, and delta cells are the one which is producing somatostatin, and this somatostatin is used to control both glucagon and insulin secretion. Understand? So alpha cells are responsible for glucagon, beta cells for insulin, gamma cells for polypeptide. Polypeptide is not an endocrine hormone. Please remember that. Okay, which is used for the metabolism of the protein. And the last one is delta cells, which is used for production of somatostatin, which is used for controlling both alpha as well as the beta cells. Okay, and next one is the family in which the husband goes to reside in the spouse house after marriage. Here the question you should understand properly. The husband is residing in the wife house after marriage. Usually what will happen? Wife will come to the husband house after marriage, but here the husband is going to the wife's house after marriage. In this condition, it is called as matrilocal. Option A is the right one. Matrilocal. Husband is going to the wife house. Okay. If wife is coming to the husband house, patrilocal. Okay. What is matrilineal and patrilineal? The descents of the family. For example, husband, wife is there and they are having a kid, and the kid will be called by his or her mother's name. For example, usually how the name will be in the beginning, there will be a first name, that is surname, and the person name will be there. For example, if you take Kannan means it is the name of the person, and in the front what will be there? Initial will be there. M Kannan, J Kannan, K Kannan. Okay, so this M or J, whatever it is, the initial will be the name of the father. Right? If it is in the name of the father, the initial is in the name of the father. Otherwise, the surname, the first name or initial name, if it is in the name of the father, it is called as patrilineal. But it is in the name of the mother means it is called as matrilineal. Okay, here matrilineal means they are giving more importance to the mother. Patrilineal means they are giving more importance to the father. That's all. Okay, fine. The next one is norms, beliefs, values are the components of. See, here many students have made the mistake. Many are selected society. But if you take the definition or the components of culture, it consists of these following things, like symbols, language, value, beliefs, norms. Okay, so these are all the components of the culture. Okay, norms, values and beliefs are the components of the culture, not the society. So here the right answer is what? Option C. Next, question number 13. All of the following are the defensive coping mechanism except defensive mechanism. There are many defensive mechanisms, right? For example, denial, suppression. Denial is there here. Repression is there here. Sublimation, regression, suppression, projection, displacement, reaction formation. All these things are coming under what? Defensive coping mechanism or defensive mechanism. For example, let me give some example. Denial means what? Not accepting the particular situation. For example, a known example I am giving to you. Suddenly a patient is diagnosed with a cancer and this information reached the patient. So that time the patient will not accept the person is having the cancer. Okay, after some time he will realize and accept. First in the beginning he will not accept. This is called as what? Denial. Repression means, repression, the option C is repression, right? So what is repression? Unconsciously removing the stressful or traumatic thoughts from the conscious brain. Unconsciously removing the stressful thoughts from the conscious brain. That is called as what? Repression. Okay. Consciously avoiding the stressful thoughts is called as suppression. Suppression and repression. These two things you have to remember. Repression means unconsciously removing the stressful thoughts. Suppression means consciously removing the, wantedly removing the or avoiding the stressful thoughts which you would have came across in the childhood. Okay, that is the difference between suppression and repression. Displacement, showing the angry or towards your boss to the children. You would have been getting some problem or stressful situation in the office and you cannot express your emotions or anger in the office. You are coming back to your home and showing your anger to your family members. That is called as displacement. Projection means blaming others. That is projection. Okay, so sublimation. Sublimation means your negative thoughts you are transforming or changing into the positive one. You are having so much stress, so you are going to the gym and doing some workout and making your body fit. Okay, so negative things are transformed into the positive one. That is called as what? Sublimation. Okay, so these things are coming under what? Defensive coping mechanism, whereas withdrawal is not a defensive coping mechanism. It is a fight or flight action. The withdrawal means if there is a stressful situation, you are going to escape from that stressful situation. You are having exam tomorrow, you didn't study for your exam, so you are not going to the school or college or competitive exam for writing the exams. Okay, so you are escaping from the situation. It is not a defense mechanism. Fine. So here the right answer is option A. The next question is, a complex process defined as a state of focused awareness with the readiness to respond is known as. It is a direct question. It is a definition, guys, actually. Okay, a complex process defined as a state of focused awareness. First keyword is focused awareness, state of focused awareness. Second keyword is readiness to respond immediately. Focused, readiness to respond. If these two keywords are there, means it is the definition of what? Attention. So option B is the right one. Next, question number 15. Protective eyewear should be worn all the time when the nurse is. So goggles or eyewear has to wear all the times. In which type of situation? Which kind of situation? Giving personal care to the AIDS patient, obviously. Why? Because it will be transmitted through the body fluids. If there is unfortunate spill of blood stain in the eyes of the nurse or the healthcare workers, easily there is a chance of transmission, right? So while giving personal care to the AIDS patient, that time what we supposed to do? We have to wear the goggles. Okay, bathing the neonate for the first time, not required. Drawing the cord blood, that time, yes, obviously that time it is required. Okay, but when compared to the AIDS patient, we have to give priority, right? So we have to give priority to the AIDS patient when compared to drawing the cord blood. Okay, taking specimen to the laboratory, you are going to carry the specimen in the box, ice box, right? That time not at all required. So either option A or option C. Among these two, which one we have to give priority? Option A. So option A is the right one. The next one. Ethics in nursing is concerned with all except. This is also a little bit confusing question. Why? Ethics in nursing is concerned with all except. This is the except question. Ethics means a principles, a rules and regulations. It is based upon a good conduct. Good conduct means it is a character. Okay. Again they asked good character. Good motive, yes, good motive is the right one. Good governance, yes, good governance is the right one. Governance means what? In the word, you are the manager. You are playing a manager role in managing each and everything. Right? You are controlling, if you are working in the government sector, you would have been known that you are the only person responsible for your ward. You have to think your ward as a house. How you will manage your house, same way you have to manage your ward. You have to control the nursing orderly, the one who is working below you. You have to control the safai wala, that is the BVG workers below you. And you have to give instruction to the JR doctors, right? And if the SRs are giving any order, that is senior doctors are giving some orders, it has to be implemented by you. Okay, and controlling the patient, controlling the cleanliness of the ward, and maintenance of the drug, first in first out. Okay, everything is controlled by whom? Which person? The nurse is playing a managerial role also. So that is called as what? Good governance. So good conduct, good motive, and good governance, these three are the right one. And good character is not coming under ethics. Okay, so option B is the right one here. The next one, 17th question, the need to be self-fulfilled, learn, create and understand. Okay, these are all the things coming under what? Self-actualization. Direct question. You can see here. Need to be self-fulfilled, learn, create, understand and experience one potential is called as self-actualization. Means understanding the self. How you will understand yourself? You have to learn, create and understand and experience your potential. All these things are coming under what? Self-actualization. And what about self-esteem? Self-esteem is different. Self-esteem is related to the recognition. How others are recognizing you. How you are recognizing you. How much respect you are getting within you. You are giving towards you. How much respect you are getting from outside. What is the status? Okay. So respect, recognition, status, strength. All are coming under what? Self-esteem. Physiological needs means the basic need to survive in this world. That is called as physiological needs, like food, shelter, water, sexual urge. All these things are the basic one. Right? And love need means love and belonging. Means the affection, feeling of belongingness, a relationship with others. All are coming under what? Love needs. And here the right answer is option D. Okay. All are the barriers of effective communication except lack of sufficient time due to workload. Yes, this one is right. Because of workload, there will not be any time to communicate with the patient. Sympathy and patient assignment. If they are assigned properly, then more patient is assigned to one nurse. Okay, so how the nurse will communicate with the patient? It is not at all possible, right? So patient assignment is also playing a vital role in lack of communication. Language issues. If there is a language, especially for North Indians, if they are going for South India, there will be a language barrier. South Indians, they are coming to the North India, means there will be a language barrier. Northeast peoples coming to the South India or North India, means there will be a language barrier, right? So definitely language plays a vital role in barrier. And what about culture? Culture is not going to be impact more when compared to others. So we can consider option C as the right one. One of the following step of nursing process relates to stating problem and issues. Here the keyword is stating problem and issues. And nursing process. In nursing process, what all the things will be there? Assessment, goal, nursing diagnosis, assessment, diagnosis, goal, intervention, implementation. Implementation we used to write with the rational. And the last one is evaluation. This is how we will be writing our nursing process. In the assessment, what will be there? Subjective data and objective data. Right? Subjective data means what the patient is saying to you, the complaints what they are expressing to you, the problem they are expressing to you. Objective data means what you are finding from the patient. Okay, fine. So these things, subjective, objective, where you are finding the problem and also the patient is saying the problems to you, and the last you are the one going to finalize these are all the problems the patient or the issues the patient is having. Okay, so here which is the right answer in the nursing process where you will find the problems and issue? Assessment. So which is the right answer here? Option A, assessment. Next question is, all are the principles of proper body mechanics except? We have to maintain balance, yes. Bended knee, yes. Obviously, you should not bend the hip. If you are bending the hip or the back, you will be having what? You are giving more stress to the back. So we should not use the back. Instead, we have to use the knee for bending. And use small muscle groups. Obviously, we have to use the small muscle groups. Okay. And which is the wrong answer here? Carry object close to the midline is the wrong one. So answer C is the right one. Next. Question number 20. Okay, it is over, right? Question number 21. All of the following are the comfort devices used for the cardiac and respiratory patient except. This is also a except question. Fine. So what is the question here? What is the key point you have to look into the question? The keywords are comfort devices used for cardiac and respiratory patient. These are all the keywords. So what are all the comfort devices we will use for cardiac and respiratory patient? Pillows, yes, for pillows we will be giving keep over the back so that the patient can sit comfortably in fowler's position or semi-fowler's position or low fowler's position or even in the tripod position. Tripod position means sitting and bending or leaning forward. Okay, so these are all the things which we can do with the pillows. Next one is backrest. While sitting, we are going to use the backrest. And next one is cardiac table. For eating, we will be using what? Cardiac table. Okay. So these three things we can use. What about the bed cradle? Bed cradle is used to prevent the weight of the sheets, whether the top sheet or the blanket over the knees or the affected part or the lower legs. You can see here the bed cradle is commonly used for the burns patient. Okay, so here the patient leg is there and the bed cradle is kept over like this and the sheet is covered over the bed cradle. It is used for increasing the amount of air circulation and also it prevents the linen to touch over the injured area, and it is also used for covering the patient. Okay, and this bed cradle is nowhere going to useful for the patient who is suffering from cardiac and respiratory disease. So here the except question, what is the right answer? Option A. Fine. The next one, question number 22. All of the following are the nursing responsibility while bed making except. Here they have given 4 options. This is also except question. Mostly except questions are given here. Right? Fine. Let's see. Option A, holding soiled linen away from the uniform. Always we used to hold the soiled linen. Soiled means what? Stained linen away from the uniform. Right? Fine. That is the right one only. Next, placing soiled linen is the portable linen hammer. We will be discarding the soiled linen in the laundry bag. Right? So this is also right one. Gathering all linen before starting the process. Obviously, before doing bed making, we will be gather all the linen and then we will start the bed making. Okay, arranging articles, right? That is very important before doing the procedure. This is also right one. Shaking the linen to remove the microbes. It will cause what? Cross infection. So we should not do this one. Okay, so here the right answer is option D. Next, question number 23. All of the examples of moist heat application except. Moist heat. Moist heat means when you are applying heat, it is having some moisture, some watery feel. Okay, for example, if you take a fermentation technique, if you are taking the cloth and if you are dipping over the hot water or a warm water and applying over the pain area, means it will create what, a wetness, a moist feeling you will get. At the same time you are getting some warmth or heat, right, which is used for the dilatation of the blood vessels, and also you will be getting what, muscle relaxation, and the pain will be decreased, right? So what are all the things are considered as moist heat application? That is the question here. The keyword is moist heat, and here they have given four options. Poultice. Poultice means, again, they will be taking a soft cloth and they will be keeping some medicine in that, and they will be covering it and they will be applying over the area. This is also a type of moist heat. Paraffin bath, it is also a type of moist heat. Hot pack, we are using the hot water bag, right? It is also a type of moist heat. Infrared rays is the dry heat. Okay, so option C, there is no direct contact between the infrared rays and the body. Okay, the infrared lamp, it will be here, the lamp will be here, this is the lamp, okay, and the body will be here, this is the patient body. Okay, so the light rays will come and touch the patient, there is no direct contact. Understand? Yes. So this is the dry heat. It is coming under what? Dry heat. So here the right answer is option C, infrared. Question number 24. One of the following stand for immediate administration of drug. Immediate is the keyword. Immediate administration of drug is the keyword. So in which order we will administer the drug immediately? Stat. S-T-A-T, stat. This is the direct question, and here the right answer is stat. What about other options? PRN means whenever required. Whenever there is a vomiting to the patient, you give emicet, injection emicet or injection ondansetron to the patient. Okay. SOS means if necessary, the patient if having the pain, that time you give the painkiller, tramadol. Okay. Stat means immediately. Now you give the drug. After that you should not give the drug. Only one dose. Now at present you have to give the drug. That's all. Okay. So that is called as what? Stat. So here the right answer is option D. Next. Very simple question. Bandaging and splinting are essential measure during one of the following emergency. When you will do the bandaging and splinting? Bleeding, sprain, fracture, wound. Here we have to give the priority, and here the right answer is option C. While fracture, you will be using the splint as well as bandage to support the fractured area. So here the right answer is option C. The same way we will be posting. These are all the 25 questions. Today I have going to post. I already posted, and other question I will be posting in part 2. So please watch the video and understand the concept. Understanding the rational is very important. So please keep on watching our videos, support our channel. If you are keep on supporting our channel, definitely it will motivate us to post more and more videos. Share these videos among with your friends. If you not subscribed until now, please subscribe and click on the like button and also the bell button, so that you will get the intimation whenever I am posting the video. Thank you very much guys. Watch the video and wait for part 2 also.